Thank you for joining us today. My name is Jillian Smith. I am an emergency medicine and urgent care physician here at Cooper, and I've been at Cooper for just a little over 6 years.
And my name is Lisa Butler. I'm the lead NP for the Cooper Urgent Cares and the Emergency Department, and I've been at Cooper for 15 years.
So we're here today to talk about the when and why of urgent care. So we're going to go through a couple questions and let you know a little bit about our urgent care centers.
Great. So Jill, the first question we have here is, what are the basics about our urgent care centers, such as our access, our locations, that type of thing?
So we have 4 urgent care centers. The locations are Audubon, Cherry Hill, Cinnaminson, and Runnymede. During the week, Monday through Friday, we're open from 8 a.m. to 7:45 p.m. And on the weekends and holidays, we're open from 9 a.m. to 4:45 p.m.
Okay, great. What is the role of an urgent care center compared to an emergency department or your primary care physician?
So an urgent care is a little bit different from your primary care doctor or primary care physician. Your primary care physician or pediatrician is really someone who's going to manage your long-term medical care and chronic medical conditions and wellness. So we are not meant to really take the place of a primary care physician.
Great. And some common reasons you might visit an urgent care, things like sore throats, sprains, colds, injuries, that you might have playing sports. There's various things that we can take care of here. We do have an x-ray on site, so we can image things like your chest if you're having a chest cold, or infection if you're concerned about a pneumonia, or maybe you sprained your ankle and you want to see if it's broken. We have x-ray on site as well. That's something we can do. And other studies, Jill, you can talk about a few other things that we can do here?
Yeah. So anyone with respiratory infections, such as cold or flu, sore throats, earaches, urinary tract infections, pink eye, and those are really the most common reasons we see patients here at urgent care. We also do provide the ability to do sports physicals and pre-employment physicals here, and we do have some vaccines, such as the flu vaccine and tetanus.
Great.
So reasons to go to the emergency department, some things that might be a little beyond the scope of practice of an urgent care would be anything that patients would be considered life-threatening. So severe chest pain, shortness of breath, severe abdominal pain, any stroke-like symptoms, falls if you're on blood thinner, another reason to visit the emergency department, and any severe traumatic injuries. Those would really be reserved for the emergency department.
Great. So we have a question coming in live, and it says, do you do sutures? And this is from Amanda on Facebook. And yes, Amanda, we do suturing here. So if you have a laceration, we're happy to take care of that. We do suturing here. We can do stapling here if it's, say, a wound on your scalp. We can also do skin glue if it's a superficial wound that doesn't require suturing, and that's very helpful for the pediatric population. So kids that come in sometimes with a very minor injury, we can sometimes glue it, and then, they definitely like that better than stitches.
Definitely. And this is a question that we get commonly. We do sutures, and we also do some other minor procedures. So we can also drain abscesses. We can take out foreign bodies that are very superficial. So something on the skin that's under the skin, we're able to take those out.
Yeah. And sometimes somebody drops something on their toe and they get some blood under their nail. We can, release the blood out of the nail to help that, the pain, and it's something that we can do very easily here at urgent care.
And we also take out sutures. So even if you haven't had your sutures placed at our urgent care, you're able to come here to have your sutures removed if that's something you'd like to do. So another question from Kim on Facebook, do you do sports physicals for kids? Yes, we do. We do sports physicals for kids, as well as school age, school physicals for kindergarten and up.
Yep. Yes. A question that I have here is, if I don't have a primary care physician, can I still visit an urgent care center? And that is absolutely yes. We actually have a wonderful person that is our discharge coordinator. So when you come in with a complaint, we can evaluate you and see exactly what you need. And her name is Tabitha. She can help you get in to see a Cooper primary and schedule the appointment for you. And she also does a great job at getting people into specialists. If you need a specialist appointment, she can actually schedule that for you. So it's a great thing, I think, to have for urgent care.
Yeah, if, say for example, you come in and you break your ankle, we're able to splint you here, and then Tabitha can get you, before you even leave our urgent care site, can set you up with an orthopedic appointment, so you have that scheduled, which is a great benefit to our patients here at Cooper Urgent Care.
Yep. Another question came in from Kim on Facebook. Do you have an ultrasound or a CAT scan machine? So the answer to that is no, we don't have an ultrasound or CAT scan machine. We certainly can evaluate you to see if those are some studies or tests that you might need. If we feel that there's something urgent or more urgent going on than we can handle at urgent care, we will refer you to the emergency department of your choosing. You can really go anywhere, but we do like to call ahead to that emergency department and let them know that what we're concerned about and what you're going to need when you get there. So while we don't have those things here, our clinicians are very skilled at knowing if you need something like that, and then we can refer you on to higher level of care.
Yeah, the only imaging studies that we are able to do here are x-rays. And something else that frequently comes up is if a patient has a prescription for an outpatient study, such as an x-ray or a CAT scan or ultrasound that was ordered by another provider, that is something that we can't do at urgent care. That needs to be done at an outpatient radiology center. So our patients here that we evaluate, we can do x-rays here, but anyone with a prescription for an outpatient study needs to visit one of our radiology centers to have those done.
All right.
So next question on the list, what kind of patients do you treat? So we see patients of all ages here at Urgent Care, so you're more than welcome to come in. We see pediatric patients and elderly patients as well, so anyone's really welcome to come in for evaluation.
Great. One question here is, do urgent care centers offer preventative care? And the answer to that is not necessarily. We don't offer preventative wellness care in that sense, but we do have flu shots, tetanus shots, PPDs available to the public for that type of prevention.
All right, next on the list. Who works at an urgent care center? So one of the things that differentiates Cooper Urgent Care from some of our competitors is that we are staffed by board-certified emergency physicians. So on site, all hours, is a board-certified emergency medicine doctor for your care.
And we also do staff with advanced practice providers. So we have physician assistants and nurse practitioners that all have an urgent care medicine or emergency department medicine training and background. So we're very all skilled at reading x-rays, interpreting x-rays, prescribing medications that are appropriate. So that's great.
Okay, Amanda on Facebook has asked, do you take all insurance? So we take most insurances. I believe that there is on our website a list of insurances that we do accept. One major insurance company that right now we are unable to have a contract with is United Healthcare. And while the Cooper outpatient offices do accept United Healthcare, we do not accept United Healthcare here at Cooper Urgent Care at the present time.
Yeah, but you can always check our website for the list of the insurances that we do take.
Mm-hmm.
So, great.
All right.
I have one here, Jill, that says, if I can't tell that I'm sick or have allergies or say something else is going on, should I wait it out or should I go to an urgent care center?
That's really up to you. You're more than welcome to come in. We're happy to see you for any of the complaints that we have gone through earlier. But if you feel like you want to be seen sooner rather than later in that, if you're feeling sick, come on in and we will see you.
That's great. Let me see. Thinking, is there anything else patients should know about urgent care centers and how that can fit into their care? I think that one of the benefits of urgent care, and you'll probably agree with me, is that it's very convenient. Mm-hmm. We have pretty good hours during the week. We're open until 7:45 at night. So if you're just getting off of work and clearly your primary care doctor might be closed, you can't get there, we're open till 7:45. So it's very convenient for patients to come and be seen and be evaluated.
Yep.
And like I said, I think we have a great referral where we can get you in to see a primary if you don't have one, or if you need to see a specialist. We have an avenue to kind of get you an appointment for that as well.
Yep. And we also have the ability to reserve your spot online. So most of our patients are walk-in patients. However, if you go to the Cooper Urgent Care website, you are able to choose one of the 4 locations, and there is a spot to essentially a box to reserve your spot online. So that is one of the features that our patients really do like. So if you know that you're going to be getting off work at 5 o'clock and you can get to one of our locations by 5:30, you are able to reserve a spot for that evening, so that way you can come in and be seen.
Great. And we have a question from Brian on Facebook. Where are you located? So we do have 4 locations currently. We are in Cinnaminson, New Jersey, off Route 130, in Cherry Hill, and we are in Audubon, and also out in Runnymede. Those are the 4 locations that we have.
Yeah, the Cherry Hill location is right off Route 70, and the Runnymede location is on the Black Horse Pike, of course, across from the Philly Diner. And the Audubon site is next to the Wawa in Audubon.
Oh, good. I'm glad she knew, because I'm from Philly, so. I don't know all the streets, but I know how to get there. All right. Do we have any other Facebook questions currently? No. Okay. So let me see if we have anything else on our list to discuss.
I think we kind of went over
I think we covered most of it. So I think we're all set. So
we have another question.
We have one more question coming in, and then we can wrap things up.
What is the difference between Cooper and other urgent care centers?
Okay. So I think the biggest difference between Cooper and other urgent care centers is that we are staffed by emergency department physicians. So we are all board certified emergency department physicians. That's probably one of the bigger things.
And I think too, we do have the resources of Cooper. So if we are seeing a patient and we're concerned about an x-ray, we're kind of like, well, I'm not 100% sure. Let me just call the radiology team, and they can take a look at the film for us to help us as well. We always have resources in different specialties we can bounce ideas off of.
Right. If you're a Cooper patient and you see Cooper cardiology or you see Cooper urology, if we have a question, we are able to call someone from that service, and if we feel that's necessary, to try and coordinate your care.
Great, yes.
And the other big thing, I think, is that we do have the Discharge Coordinator that we discussed to help you get follow-up appointments and
specialty
care.
Sure. Yeah.
And expedite that care.
Yes. So, yeah.
All right.
Anything else?
I don't think so. I don't think so.
Fantastic. So, well, thank you for joining us today.
Yes, thank you for joining us.
Appreciate you being here, and we'll see more of you in the future.
Yeah, and if you have any other questions, feel free to visit the Cooper Urgent Care website and visit one of our locations.
Yeah, and it's cooperhealth.org, and you can select Urgent Care under the search tab. Thank you.
Thank you.